Okay, everybody, thank you so much for joining. I think it's 2 after here, so I think we should get started. We do have two presenters today. We've got Helios's Chief Medical Officer, Dr. Antonella Favit-Van Pelt, who will be starting the presentation just to go over PoNS and PoNS therapy. And then following Dr. Favit, we do have Carrie Walters, who is a PoNS user and will be sharing her experience. And as I mentioned, at the end, we will be taking questions. We will address that at the end. You will have an opportunity to either ask a question in the chat, or we can certainly take you off of mute. So with that, Dr. Favit, I'm going to turn it over to you.
Good evening, everyone. I'm Dr. Antonella Favit-Van Pelt, and I'm Helios Chief Medical Officer, and I welcome all of you to this webinar. I will be taking you through some information around PoNS therapy, and feel free, as Michelle has said, to ask questions after the presentation. I'm going to share my screen. Okay, I guess all of you can see this. All right, 1 second. Okay, and I assume
all good.
All of you can see me and hear me. Okay.
Correct.
So PoNS, the portable neuromodulation stimulator, is a neuroplasticity therapy in the United States indicated for people with multiple sclerosis. In May 2020, the PoNS device has received breakthrough designation for the treatment of gait deficit due to symptom of MS. And in March 2021, we received FDA marketing authorization. And this is the only medical device that is cleared in the United States for this indication. And specifically, for use as a short-term treatment of gait deficit due to mild to moderate symptoms for multiple sclerosis, to be used as an adjunct to a supervised therapeutic exercise program for adults 22 years of age and over by prescription only. So the PoNS device is an orally applied therapy which is delivered by neurostimulation and consists of a lightweight portable controller that is worn around the neck and a mouthpiece with 123 gold-plated electrodes that is positioned to electrically stimulate the anterior dorsal of the dorsal tongue. It promotes a cranial nerve neuromodulation, also known as translingual neurostimulation. The way it works, the mouthpiece sends electrical stimulation to nerve fibers in the tongue while the person is performing gait and balance exercises. In this way, PoNS device, combined with physical therapy, promotes neuromodulation. And when it's used consistently and regularly, it triggers neuroplasticity, which results in a significant improvement in gait and/or balance function. I'm going to show you a video that explains how the PoNS device works.
The tongue is innervated by branches of the trigeminal and facial nerves with direct connections to the brainstem. Clinical evidence suggests that using PoNS therapy, PoNS device plus physical therapy, can induce neuromodulation effects by the translingual stimulation of the lingual nerve, a branch of the trigeminal nerve, and the chorda tympani, a branch of the facial nerve. This stimulation promotes specific activation of targeted nerve centers in the brainstem and cerebellum, which are associated with movement and balance. This process activates mechanisms responsible for neuromodulation of signaling pathways from and to specific areas of the cerebral cortex. Sustained neuromodulation by PoNS-induced activation of these cortical areas is likely to trigger, in these regions, a series of adaptive changes through a process known as neuroplasticity. The neuroplastic process is expected to rehabilitate existing pathways, as well as engage new mechanisms that can deliver functional signals to the spinal cord. Consistent and repeated application of PoNS therapy over 14 weeks is likely to consolidate these functional compensatory pathways and potentially lead to a sustainable functional improvement over the 14-week treatment period.
Okay. So I hope you guys enjoyed the video. It's very informative about the mechanism of action. And what I think is important about the mechanism of action is that differently than any other device or non-pharmacological therapy that assist with rehabilitating gait and balance, which act peripherally, PoNS acts centrally, meaning that it upregulates mechanisms in the brain and not in on your leg or your arm, and therefore regulating mechanisms in the brain sends a signal to the limbs or to the affected region where the function needs to be performed, and then by sending the signals is able to rehabilitate that function if the person performs the exercises. So how does PoNS rehabilitate, helps rehabilitating gait? Well, PoNS is supposed to be used in combination with physical therapy. And in general, a course of PoNS therapy is 14 weeks. Of these 14 weeks, the first 2 weeks are usually performed in clinic with the help and the assistance of a physical therapist. And the additional 10, 12 weeks are performed independently at home with regular checkup visits with a therapist throughout the 12 weeks period. So how to use PoNS therapy? So the PoNS device is provided to you upon purchasing, and you will bring this device to the clinic on your first day of the rehabilitation, and the therapist will activate the device and will go over with you a full schedule of therapy, of exercises. So the therapist is going to put together a therapeutic, rehabilitation program, meaning the type of exercises that you need to perform to rehabilitate your gait and your balance over the 12 weeks period. So you are expected to um, do 3 exercise sections daily, one in the morning, one in the afternoon, and one in the evening. Each exercise session consists of using the PoNS device, so activating the PoNS and putting the mouthpiece in your mouth for 20 minutes at the time. So you will do 20 minutes of activation when you perform your gait exercises. Then you take a little rest, a little break. Then you activate the device and you put your mouthpiece in your tongue for another 20 minutes while you're doing your balance exercises. Then you take a little rest, and then you will put your mouthpiece and activate the device for 20 minutes of relaxation therapy. So mindfulness, and you'll be trained on what that relaxation therapy consists of. So you're supposed to do this at least twice a day, right? Um, for the gait and balance. And you can do the mindfulness therapy once a day. In general, on average, the recommended dose, meaning the recommended number of minutes that you need to use the therapy, is between 100 and 120 minutes a day. Now, one thing that I want to make sure it's understood, this is an individualized rehabilitation therapy, meaning that when you go to the physical therapist on your first day, you're not expected to do, 3 sessions per day, 20 minutes, 120 minutes. If you're able to perform it, the physical therapist will prepare a rehabilitation schedule that fits your needs. The objective of the therapy is to build endurance. So on day one, you might not be able to do, the entire 100, 120 minutes. On day two, you might do a little more. On day three, a little more. But the objective here is that within the first week or the first 2 weeks, and that's why we recommend to go to the clinic in the first 2 weeks, the objective is to, by the time you're done with the 12 weeks, you are then in a position when you go into rehabilitate and perform, the exercise at home to do, the whole day, 100 and 120 minutes a day. So to perform the 3 exercise sessions a day, 20 minutes of PoNS while doing the gait exercises, 20 minutes of PoNS when you do your balance exercises, and 20 minutes when you're relaxing in the morning, in the afternoon. And then in the evening, usually you would do just the relaxation therapy. So with this rehabilitation program, we have demonstrated that PoNS therapy is effective in improving gait in people with multiple sclerosis. A clinical study, which is a randomized controlled trial, which means that the study used an active PoNS device and a sham PoNS device in 2 different groups that were assigned, randomly assigned to either the active or the sham. And what we have shown that in this clinical study, 100 all subjects that were in the active group experienced an improvement of their gait measured by the dynamic gait index on average of 7, almost 8 points from baseline. Another study showed the same type of improvement, but provided also the imaging evidence that have proven how PoNS works that you've seen in the video that I have shown you. In addition, we have a significant body of real-world evidence that have shown, when we analyze the data, that people with MS, and these were data from people, in Canada, utilized the device in Canada because initially was approved in Canada for MS, would have shown that more than 50%, almost 60% of these people that used the device and the therapy in real world clinical practice. So in real world, this was not a clinical trial. These are regular people like you that they have gone to the clinic, that they have used the device at home, that they've implemented the recommended 100 to 120 minutes a day. And what is shown, this real world evidence, set of data show that at least 60%, almost 60% of these patients had at least 4-point improvement in their gait measured by a similar scale called the functional gait assessment, which is similar to the dynamic gait index. So as you can see, the data from the clinical trials were automatically were matched by the data of patients using in real life. So I wanted to show you in clinical trials, I wanted just to go a little bit more and show you what happened in the clinical trials. So in clinical trials, we had 2 groups of 10 each. One group was assigned to the active device, and another group was assigned to a placebo sham device. And both groups had physical therapy. So as you could see here, from baseline to week 14, the patients in the active group exponentially improved, so that by week 2 they already had a clinically meaningful improvement in their gait. So which means, like I was saying before, that they had build that endurance that allow them to start, to start seeing results, to start seeing the neuromodulation. By week 10, they have reached their maximum improvement because between week 2 and week 10, those mechanisms of neuromodulation has triggered that mechanism of neuroplasticity, which means that the brain has had the opportunity to rehabilitate those impaired pathways that were limiting the functional ability, so that they were limiting the walking and the balance function in the patients. Now, what is really important here is that you could see that patients that reached that improvement, and 100% of these patients, reached this improvement, then we're able to maintain the improvement over the course of the 14 weeks. So they reached improvement at week 10, and by the week 14, they have maintained that improvement. The same thing did not happen in the sham group. As you can see here, these patients were going through the same rehabilitation, the same physical therapy, but they were using a sham device, a device that didn't provide the stimulation in their tongue. So what you could see here is that they did improve because physical therapy provides some, improvement, some rehabilitation. But what happens is they never reached the same level of improvement. And by week 10, the improvement that they gained slowly declined over time. And this is the biggest part, because it's probably due to the fact that the neuromodulation that the physical therapy is inducing did not produce the neuroplasticity needed to maintain this effect. So we have just recently completed a study in patients that underwent PoNS therapy in real world clinical practice. Yes, it's a study. It was done at 6 centers of excellence in the United States, but the expectation was that they were using the therapy as you would. So what happened is that in this study, where we have looked patients with gait balance, MS patients with gait balance, who went for the 14 weeks of rehabilitation therapy with PoNS. The study confirmed the same results that we had, that I showed you before in the clinical trials and in real world evidence, but added an important component, The study was aimed to explore the relationship between treatment adherence, so treatment compliance, and the therapeutic outcomes over the 14 weeks period. And in addition, it was set to demonstrate the durability of effect. So once you stop the treatment, what happens during the following 6 months. So what we have demonstrated, and this data are going to be presented next week at ACTRIMS, which is a big conference for scientists and physicians. They treat multiple sclerosis, whether they do physical rehabilitation or pharmacological treatment. This is the world of medical, the medical community for MS. What we have demonstrated is that treatment adherence was directly linked to the level of improvement that patients have reached in their gait function, meaning that the more they used, so the more treatment compliance they were, the higher the improvement that they reached. So 50% of these participants who were compliant by 85 to 100% adherence, meaning that they had done between 100 and 120 minutes of PoNS therapy, they reached nearly 7 points of improvement. So if you remember the slide that I showed you earlier, in clinical trials, in a controlled clinical setting, all patients that underwent the full dosing, they reached almost 8 points. And as you can see here, if you stay adherent to the regimen, you can get the same level of improvement. In addition, we said, we'd ask ourselves, what is the lower threshold of treatment compliance that you need to have to reach some improvement? And what we showed is 74% of participants who were at least 70% compliant with the treatment had a meaningful, statistically significant improvement of 4 points in DGI. Now, the next set of data that I'm going to show you is being submitted to the Consortium Multiple Sclerosis Conference, which is another big conference for therapists and physicians treating MS, but is not yet made public. So you're going to have a preview of this data because this data is going to be presented at CMS in June. So the gait and balance deficit that you reached at the end of the 14 weeks was maintained after the 6 months. So 6 months after you have finished your therapy, and whatever improvement you reached at the end of week 14, that improvement was maintained for the 6 months that we have observed the patients. So this is, in a sense, the confirmation of the data that you've seen in the previous slides, where you reach the improvement at week 10 and you don't lose it at week 14. And now we're showing it that you don't lose it, after you start treatment for 6 weeks, for 6 months afterwards. So safety is very, the device is very tolerable, and it has an excellent safety profile. There were no serious device-related adverse events reported, and those that we observed in clinical trials were mild and well tolerated, and usually were related to increased salivation, some headache or joint, the mandibular joint, and some fatigue. Now, what is important in clinical trials, what we have demonstrated is that PoNS is able also to reduce the number of adverse events that were related to falls and, and headaches as well. So the PoNS therapy is being used in clinical rehabilitation in over 480 patients since 2019, and in more than 180,000 patient sessions recorded. Actually, we are already at 220,000 patients session recorded without any serious device-related adverse event reported. So we confirm the data that we've seen in the post-marketing surveillance and in the clinical trials. So this is a slide that shows the contraindication. So there, the PoNS devices should not be used if there is an active or suspected malignant tumor in areas where you have recently bleeded or have open wounds in your mouth, or in areas that lack normal sensation. And then there's some cautions that your physician would need to consider when establishing whether you qualify for to receive PoNS therapy. And now it is my pleasure to introduce Carrie, who is a patient with MS that has undergone PoNS therapy, and I will leave it to her to tell a little bit about her experience. And thank you so much for your attention, and I will be on to take your questions.
Thank you so much. That was really wonderful. Some new information that's always great to hear too. So yeah, I'm Carrie Walters. I live in Southern Oregon, and I was officially diagnosed with MS at age 21. I feel like I might have had, there were some symptoms prior to that, but so that was about 36 years ago, and my symptoms were fairly mild for about 15 years, and I was really struggling to walk much of a distance before PoNS. I learned about PoNS just kind of by a random encounter, interestingly, in Portland, Oregon. My husband was there for a conference. We were both there, and Montel Williams came walking through the lobby. And I said, well, I have to go meet him. And so he was just really encouraging. He had used the PoNS early on, and he encouraged me to kind of follow the info and try to get in on a study if that was possible. So when I was following it through the Helios, and once it became FDA approved, I just pretty much called immediately and was one of the first to get the device, I believe. And then had to encourage physical therapists because they knew nothing about it and just trust me on this, that this was going to be wonderful. So they went through it and they were super supportive and kind of amazed at the improvements, just even from the beginning. There were a couple of them trained, and you don't need more than one, but I think the second one became curious. And so, we'd go in and they're like, I'm not doing anything. You're doing all the work. I said, well, you're making sure I'm doing all the work. So, and honestly, this little tagline, the little stuff is the big stuff. I think a lot of people would agree with that, with living with MS. And so I was now able to go enjoy more vacation, be more open to things. Like we went to the Madonna concert last year. We never would have probably bought tickets to that with such a big, there's like 20,000 or 50,000 people in the arena. I park further away without panicking that I can't get right to the store. And just really a lot of things kind of related to even that concert that, being able to pivot, or, people they don't even see you even using a walking stick, or, at that point, that was my main device and still is. We did a kind of a sibling and spouse vacation a couple years ago now, and I couldn't take my scooter on the plane because they had a recent some kind of new ruling that they weren't allowing things on this particular plane. So we decided just to go for it and hope that I could rent one there, because it was a really huge all-inclusive place, which I'd never done before. So just kind of taking the chance, and I felt more, just sturdy, and that I would be able to hopefully get that scooter. Able to kind of navigate different terrain. We did a trip to Belize, and again, my husband's he's more retired now, and so travel's always been a thing that I was really pretty nervous about. So we were doing a little bit more, and it just we did a little jungle walking tour that, again, even the tour guide was thinking, I don't know about this, and made it through the roots and the obstacles, my walking stick. And the tour guide was, I think he was a little doubtful, but encouraging, and very happy to see me get back on that boat that we had come out on. I do feel more comfortable going out, and it's really satisfying. I've lived in this community for over 30 years. I was born in the area and lived here, but so to see people that I've known over the years and just randomly say something about how they feel like I'm moving so much better, and just feel like they're just happy to see that my gait has changed. And, we all kind of check out our friends frequently and wonder how everybody's doing. My treadmill speed after the beginning rate of my speed was 1.3. And at the end of the 14 weeks, I was at 2.6 speed with a little bit of incline. So that's a pretty amazing change. And you can see there is a video on the PoNStherapy.com site of myself and a few others, where you can see different beginning and kind of outcomes of what people have experienced. Kind of a big deal for me. 6 weeks ago and 2 days, I had a total left knee replacement. And I'm doing really well. The left side was always my stronger side. So it probably got more wear and tear, more just, just kind of taken over for my right side a little bit. But with having the PoNS therapy, I felt more I felt less anxious about having to take on that level of physical therapy. And I just felt like my overall stronger going into it because of having used the therapy, and I'm able to work with my same physical therapist now. And so he knows my changes and he knows my where I'm challenged, but he's definitely, pushes me in ways that are very helpful. So yeah, MS, it's a big part of me, but it's not all of who we are, who I am. And PoNS is a big time commitment. As the doctor was saying, you got to do what you can do and kind of build up to it a little bit. I think I started seeing changes really quickly, and just that keeps you motivated. And you do get tired at times, and there will be those days. But over the 14 weeks, it's just it's amazing how things did change for me, and gave me more abilities to move easier. Try to get a massage once in a while. That's really helpful. And my person I see was amazed at like how much my neck was less tight and just things less rigid, I guess. And honestly, I really wasn't able to walk on a treadmill for a few years before that, because I would do other things like the elliptical, but I couldn't lift the right foot consistently enough for the leg. So that was a big deal. And, I had a couple little falls on the treadmill, just reality check, but learned to hook myself onto that thing because it kind of, all of a sudden we get like we're moving better, but we still have to be smart about it. But I did have my chiropractor mention to me, we all trip a little bit, Carrie, so don't be too careful. I'm like, okay. And I think it's really important to have a PT that you work with, that you can communicate well, because they really are your coach in this deal. And, you'll be doing a lot of it at home once you get through the first couple of weeks, but it's good just to have that person that you can touch base with, definitely. And, a lot of the motivation for me was I felt like I had family, and, it was a bit of an investment, but I wanted to kind of just be accountable to people. And that's just kind of the type of person that, once you start something and you want to make it, you want to have the improvements, because it's pretty amazing. I'll just stop with this last part. A friend of mine who, when she finished her 14 weeks, and she worked with the same physical therapist here, and she said, it's a marathon, it's not a sprint. And so it just, give yourself time. And I really hope that a lot of you are able to get this device and see some improvement.